The coronavirus pandemic has put extra focus on President-elect Biden's pick for the top health job in his administration. Mr. Biden has not named his potential nominee for Secretary of Health and Human Services. His transition team has also declined to give specifics. However, diversity has been a priority for the incoming administration. For more on this, let's bring in Alice Ollstein. She's a healthcare reporter for Politico. Alice, let's name some names here. Who are the top contenders for this job?
So a few top contenders have emerged in recent weeks, and these are people who have been working with the transition, and either one would be historic. You mentioned diversity, and former Surgeon General Vivek Murthy would be the first of Indian descent to have the role. He's very well respected as a physician himself. He is very close personally to Biden. He has advised him on how to respond to the pandemic throughout the campaign and now the transition. He's leading the COVID-19 advisory board that the president-elect has set up. And there are only concerns about him in that he hasn't ever run a big agency or a large staff with a large budget. The other leading contender right now is New Mexico Governor Michelle Lujan Grisham, who, again, is working with the transition. She is a co-chair of the transition. And, as governor, and also she ran New Mexico's health agency before that and served on Capitol Hill, but she sort of has that managerial experience. Now, a lot of former HHS secretaries have been governors or run universities or sort of had that, large organizational experience. And again, there are folks on Capitol Hill. The Congressional Hispanic Caucus is really pushing for her to have the role, as well as outside advocacy groups. And she would be the first Latina to take that position.
What kind of challenges, besides the obvious, will the new HHS secretary be facing? We are in the middle of a global pandemic.
Absolutely. So the pandemic, even though a vaccine is now on the horizon, it will be a long time before that vaccine is widely distributed. And so there are so many challenges, not only with developing the vaccine, manufacturing it, distributing it, deciding who gets it first, but also convincing people to trust it and to take it. That trust has really been eroded this year, trust in public health and trust in government. And so the person needs to be an effective communicator or employ a bunch of effective communicators to really bring that message to the American people. And because it will be many, many months before most people have access to the vaccine, there needs to be an effort to convince people to take measures in the meantime before that happens to stay safe. That means wearing masks, avoiding large crowds, et cetera. And so all of that will consume the bulk of the first year in office, and the person running the Department of Health and Human Services will play a very pivotal role.
We've seen the reporting that the pandemic is disproportionately affecting minority groups. How important is it for President-elect Biden to name a person of color as his HHS secretary, or is that important?
It's definitely a factor that they are considering, not just with HHS secretary, but with all of the cabinet positions. And especially as there have been some announced so far and rumored to be announced that are not people of color, that puts more pressure on the president-elect and his team to select people of color for the remaining positions, including HHS secretary. And like you said, this pandemic has disproportionately sickened, hospitalized, and killed people of color. And it would be beneficial to have, like I said, a trusted communicator speaking to the American people, acknowledging those disparities in a way that we haven't seen as much under this administration.
President-elect Biden is expected to undo many of President Trump's health policies, but how much can he really change if Republicans have the majority in the Senate in January? Is there any way he can bypass that?
So he can do a lot of things through executive action, but when it comes to the power of the purse, he really needs to depend on Congress and work with Republicans on Capitol Hill in order to get things done. We've seen how hard it's been for Congress to pass another coronavirus relief package, and Biden has said that he wants to make expanding testing, expanding contact tracing a priority. That requires sending a lot of money out to states. And Republicans earlier this year, opposed such funding and characterized it as a bailout for states. And so that will absolutely be a fight ahead. But there are a lot of things the president can do through executive action, including, like you said, stripping away some of President Trump's rules and regulations around healthcare, especially around the Affordable Care Act. So I would expect to see both a flurry of executive actions very early in the presidency, as well as a charm offensive on Capitol Hill to try to convince lawmakers to pass these pieces of his health agenda, both for the pandemic and for his broader health agenda, includes shoring up and expanding the Affordable Care Act to cover more people.
And Alice, I read your article from last week, and you said, quote, a gridlock Congress could upend President-elect Joe Biden's plan to hire 100,000 public health workers for tracing for COVID-19. Can you tell us any more about that?
Yes, absolutely. So contact tracing in this country was already hanging by a thread, and this latest surge in coronavirus cases has just completely broken it in many parts of the country. These are the folks at your local public health department who will call you if you test positive and ask, who have you been around in recent days, so they can intervene and get those people to isolate before they spread the virus further. Now there are so many cases that they can't call everyone, and they can't call everyone in time to intervene before that transmission occurs. And so just recently, the Centers for Disease Control put out guidance for states on who to prioritize calling when they can't call everybody. That's a really troubling sign. And so Biden has for months said that he wants to create this public health corps of workers of at least 100,000 people, potentially more, and they would assist in this work to help prevent the spread of the virus. And then after this pandemic is hopefully brought to an end, those workers can then work on other infectious diseases. So this would, again, require Congress to approve the funding, and that could be a real uphill battle.
You can read Alice Ollstein's reporting in Politico. Thank you very much for taking time from your busy schedule to talk to us.